Good morning. Good morning. Good morning. Welcome to your Thursday. We're so glad you're here with the Groundwork team this morning. It's good to see you all. As always, we'll give it a minute for folks to trickle in, and we'll get started in maybe a minute or so. Settle in, sip your coffee. It's kind of a rainy day here in central Ohio today, at least so far. I don't know if that's supposed to change later. My philosophy is to just sort of take the weather as it comes. I try not to pay too much attention to it because it changes so much. Maybe where you are, it's a nice sunny spring morning. Who knows? How is the waiting room looking, Marty? Do we have mostly everybody in here?
Yeah, I think we're okay to start, and then I'll keep admitting folks as they join.
Awesome. Okay, I'm also going to really lean on my groundwork colleagues to help me with the chat this morning. You have me and the groundwork team as your hosts, and I'm going to share my screen. We have lots and lots of content to dive into today. We have been on legislative spring break, but that does not mean that it has been totally quiet at the State House. We've been watching a lot of things. And as we are nearing the end of legislative spring break, those committee hearings are going to start happening again soon. Bills are going to start moving potentially again soon. So, wanted to spend this week with kind of a level setting conversation, share some of the things that we've been up to over legislative spring break this month, and also share some of the things that are somewhat like top priorities that we've been watching and really want to hear from you all as well. So if there are things that you have either been watching or have questions about, we're hoping to just have this time to get everybody on the same page as we're anticipating rolling up our sleeves and getting back to it. So, starting first with a quick recap of some of the things that we've been up to this month. In case you missed it, you've probably seen a lot of content from the Groundwork Ohio communications experts. Our theme for the month of April was around childhood trauma prevention, and this really aligned with Ohio Child Abuse Prevention Month. And so we were probably seeing a trickle of some of these communications throughout the month on our social medias and in our newsletters and so forth. And we started the month early by joining many of you on this call, probably in wearing blue on April 8th, recognizing the importance of preventing exposure to trauma in the earliest years. And we really did a lot of work centering and elevating safe babies. So, if this is something that you weren't necessarily clued into this month, if you're not familiar with the Safe Babies Initiative, Groundwork Ohio actually provides the statewide coordination for this approach. And it is a pretty unique approach. It was developed by our national partners, our friends at 0 to 3, about 30 years ago. It started in the 90s and it's going strong. Safe Babies is really designed to build practices in a variety of settings. It could be court-based settings, so working with local judicial leadership, or it could be more on community level or family serving settings, excuse me, that really center the unique developmental needs of infants and toddlers who are either involved in the child welfare system or at risk of that involvement with the child welfare system. And this approach was really designed by 0 to 3, spearheaded by 0 to 3 30 years ago, because there historically had been this belief that infants and toddlers don't remember what happens to them in their early years. This was something that was somewhat common belief, commonly held practice in child welfare settings. For example, if an infant was moved from one foster home to another, it was sort of believed that it wouldn't cause a developmental disruption, for example. But as the science of early childhood brain development has evolved over time, we now don't know that that is not true. That's not the case. Babies' brains are built on a foundation of early experiences. And so child welfare and community practices that are really designed to meet the needs of infants and toddlers and their families can help to set children up for lifelong success, even if they have experienced adversity in their early years. So that's sort of the big picture background of what Safe Babies is. And it reached an important milestone just this month, about 20 years of nationwide impact. And Groundwork Ohio is really proud to support this important work that is serving families and communities here in Ohio today. There are currently 4 pilot sites that are active in Ohio. So we are seeing families and supporting families in Cuyahoga County. They're doing a lot of community-based work in Lucas County, also serving families in Scioto County. And recently we have expanded into Franklin County as well in partnership with Nationwide Children's Hospital. So this work is growing. It is positively impacting kids and families in the communities that it serves. And as part of this effort to really raise awareness and elevate this work, we hosted a webinar last week on the 21st that's featuring a couple guest speakers working on Ohio's Safe Babies initiative. The webinar was really focused on the importance of early childhood development and infant mental health, exploring the implications of that early life adversity, and also talking about how we can build systems and build supports for families that can serve as protective factors. This was also, if you missed this part, it was, as far as I know, I've been with the Groundwork team almost 3 years now, and I believe this was Groundwork's first time offering a social work CEU for free. So that continues to be live and accessible for the next year. It's valid for 365 days. So I will invite my colleagues to please drop a link in the chat if you haven't already, if you're interested in getting one social work CEU and also learning more about Safe Babies. You can visit the link there. It's on our website. You can, it requires that you both view the recording of the webinar and complete a post test. And once you do that, if you give us about a week or so, we will get back to you with a certificate of completion if you do need social work CEUs. We also released a couple new fact sheets. So these were released, I think, last week in our newsletter. It's now available on our website under our resources tab. The first fact sheet is called Feeding the Brain. It's exploring food insecurity and its impact on early life trauma in a child's early years. And the second is Foundations at Risk, which is really exploring the impact of housing instability and early childhood trauma. Both of these resources contain the latest data available on these issues and highlight why stable access to nutrition and housing are really essential to develop healthy brains. I'm going to transition us now into sort of the lay of the policy landscape here. We have a voluminous set of State House updates that we're happy to share with you. Before I do that, though, I want to briefly mention what's happening on the federal level. There are appropriations talks that are happening in Congress. It is Congress's job to pass a budget each year. And while the president has influence, he does not have power over this process in the same way that Congress does. So really, we'll be seeing more happening in the coming month. The Groundwork team is waiting for anticipated release of draft rules for Head Start. In the first week of June is when we'll expect to see the House proposal out of the Labor H Committee. Senate is a little further behind. There's no official schedule available for them yet. I do also want to give a plug, and I'll invite my colleagues to drop a couple of these links in the chat too. The U.S. Department of Education recently released draft regulations for higher education to address do no harm for low earning professions. So there's potential for this to impact the ECE community. NACE has been putting out some information on this. They've created an explainer on do no harm that can be shared in the chat. And then they'll also be sharing a comment guide. There is an opportunity to provide comments on these rules. Those comments are due by May 20th. In our own backyard here at the state level, the next House and Senate sessions are scheduled for Wednesday, May 13th, after the primary election. Before things start heating up with bill hearings and committee activity, we thought it'd be helpful to give a quick overview of what we've been watching. Senate Bill 396 is a top headline in the last week. It's got bipartisan sponsors in the Ohio Senate through Senator Blessing and Senator Liston. Last week, the bill sponsors held a press conference, and they were joined by a family advocate and small business owner to really elevate the importance of paid leave for Ohio families. Ohio Senate Bill 396 would establish a mandated state level family and medical leave insurance benefit, and it would be sorry, I lost my words there. It would be a payroll contribution from both workers and employers, about 40 cents for every $100 in wages. So fairly small, and the proposal does include certain exemptions for smaller employers, so kind of a small business option there, and would allow, if an employee was eligible, would allow up to 14 weeks of leave for a qualifying event. I also will share if you're not familiar with the Time to Care Ohio Coalition, it's a growing statewide coalition that is the powerhouse behind this legislation. Groundwork Ohio is a part of the coalition. They also have regional subcommittees. So there's lots of different ways to get involved. There's a website I will invite my team to share in the chat if they haven't already, just so that you can learn more if this is an issue that's of interest to you. Couple things. Groundwork Ohio has provided some testimony on a few of these bills that we'll be sharing. You can see our testimony on our website. A few things we've been watching on the maternal and young child health side, starting with House Bill 561. This is one we've spoken about on the morning meeting before, and it would require child care centers and K-12 institutions to provide clear communication about vaccine exemption options for young children. And that includes exemptions for religious reasons or reasons of conscience. These are both protected under state law currently, so it would just sort of expand the requirement on childcare providers and K-12 institutions to share more education about that, and also eliminates the requirement for hepatitis B vaccinations. This received a third hearing for opponent and interested party testimony. That's when Groundwork Ohio weighed in. So that is one that we are watching very closely. We've not heard much about any interest on this topic specifically on the Senate side, but have heard a lot of interest in this on the House side. Senate Bill 352 and House Bill 742 is the companion bill on the House side. These would include a $2 million appropriation from state GRF to ensure that resources are available to expand and strengthen Ohio's perinatal behavioral health infrastructure. So really, this at the root of it, this bill is aiming to address any gaps between assessment, referral, and actual treatment access for postpartum moms with mental health needs. And House Bill 537 is midwifery bill. It's a bill that distinguishes between certified nurse midwives licensed under the Board of Nursing and a new category of licensed midwives. It also includes protections for traditional or lay midwives, and it would be overseen by the Ohio Department of Commerce. On the child care side of things, House Bill 647 is one of two primary publicly funded child care integrity bills that we've been watching this year. It would include a $5 million appropriation to cover administration of additional oversight within DCY to help them to respond quickly and appropriately when program integrity questions arise. And the second of those two bills being House Bill 649, it would require significantly more state investment, and earlier versions of the bill also required child care centers to capture photo or video evidence of a child's attendance. There have been a few amendments that have been adopted along the way to refine the language. A more recent version of the bill eliminates the requirement for DCY to store photo and video evidence of children, and pivots toward more of an AI associated and tablet photo and AI associated verification of attendance. House Bill 484 hasn't had a hearing in a while, not since November, but this is one that would create categorical eligibility for publicly funded childcare benefits for childcare workers. And House Bill 464 streamlines licensing standards for childcare providers that are certified through the rigorous system already in place through the Department of Defense. There's a few child welfare bills that we're watching as well. House Bill 532 helps to build increased communication between counties and child welfare and law enforcement when a child can't be released to the custody of a parent. And House Bill 635 and 371 are both sponsored primarily by Representative Plummer. So he's been putting out some of this child welfare legislation more recently. And House Bill 635 actually had a press conference just yesterday. You can see more about that on the Ohio channel. And it was picked up in some news coverage, but is really a bill that would require domestic violence response data to be entered into a child welfare system that would be accessible statewide. So really helps to correct any gaps in the system where a child's safety may fall through. Before I close this section of some of the legislation highlights, sorry for the jump scare. There's a lot of words here, and I promise you I will not read them. But because we will share our slides with you afterward, I wanted to include this info. So as you're looking at it later, if there's a bill that jumps out at you, you can do a deeper dive. All of these bills you see here are part of a new affordability package that was released by House Dems right before legislative spring break. Groundwork has been having some conversations with some of the bill sponsors just to learn a little bit more. So far in our conversations, we've not heard anything deeply promising about the trajectory of these bills during this General Assembly, but they are all guaranteed at least a first hearing based on the time that they were submitted. So that first hearing being sponsor testimony, not necessarily public testimony from those of us on this call that might have an interest in these issues, but at least would get a first hearing from the bill's sponsors. I'm going to stop sharing for just a second and see if we have any questions or see if there are other bills you all are watching that you'd like to elevate.
I saw Julie put a comment in the chat, Caitlin, about a federal bill that just passed. Julie, would you like to share a little bit more?
Yeah, it would align the tax, let's see, is it a credit or deduction? It would align that with the K through 12 teachers who are able to take that $350 deduction and extend that to early childhood educators. So it was bipartisanly sponsored and has passed the House.
For that, Julie. Good call in. Any others?
Can I jump in?
Please.
Hi, good morning, everyone. I'm Tamara with YWCA Columbus. We are watching House Bill 472, which is sponsored by Representatives Cockley and Salvo, and it would waive fees for identification documents for the homeless. And so because we run a family shelter, that's really important to be able to have access to workforce opportunities, anything really, right, to move in this world. And so we did testify as a proponent, and so we're hopeful to see make the finish line. Thank you.
That's great. Thank you. Thanks for sharing that.
We'll add that to our list. I remember volunteering as an attorney at one of the YWCA shelters, and for the ability for folks to get childcare, get any type of access, that was just such a huge barrier. So we'll add that to our list. Thanks for bringing that.
Thank you. I didn't know that was part of your background. That's awesome.
Long time ago, but I'm just thinking of those families that are in your shelter and all of the services they need, and that's a huge bottleneck for them.
Yep, exactly.
The rest must be crystal clear. I'm sure glad you guys are clear. There's lots happening in the atmosphere.
Linnea or Brittany, is there anything that you would underscore or anything that you feel I missed that you want to elevate?
You are super thorough, Caitlin. I appreciate it. It's a whirlwind happening, not happening because they haven't been there, but there is a whirlwind like percolating.
Hmm. Yes.
Probably important for people to understand that certainly there was a race to get a lot of bills in so that they could have a first hearing just to continue the conversation. That's was a date that was driving folks. But also the primary, which I know we'll be reminding you about later in this call, lots of folks were introducing legislation and trying to get, public attention and use their platform in different ways because they're also running for election. So we've seen a lot of activity. It's not necessarily an indicator that things are what that we want to move are going to move or things that we don't want to move aren't, given what's going on in the remainder of the year. And so much of the focus will be on the November election this fall. But we're already gearing up for what lame duck could be, which is the period of time after the election when our General Assembly members, particularly for those who are turned out, are trying to accomplish and wrap up any items before we head into the next administration and the next General Assembly in January.
Oh, what percentage of the Ohio State reps are on the election this year? I don't know if I can speak to a certain percentage. Is that an easy number, Brittany?
Give me a minute. I'll get it.
Okay. It's a good question, Shelley, because you're right. It's not everybody's terms line up quite that neatly. This is something that Groundwork is often trying to keep track of as well, whose seat is up for reelection. Brittany, while you are looking for that, I am going to advance us in the slides. You feel free to jump in and cut me off if you have words you need to share. Otherwise, I will just invite you to share them in the chat. And when Lenan said that we would be later in the presentation talking about the primary election, what she means is right now we're going to talk about that. This is another friendly reminder to make sure to vote in the primary election next week, less than a week on Tuesday, May 5th. That is just right around the corner. So there's a couple QR codes here on the screen and some links that are coming in the chat if they're not there already to find your early voting location if you want to vote early, which you can do up to May 3rd. And you can also find your election day polling location at that QR code there. When you do vote, we would love for you to please share a photo of your I voted sticker, your family walking to the polling location, or a selfie after voting. We would love for you to tag us at Groundwork Ohio and tell us why you're voting for Ohio's children and families. You can tag us on any social media platform at Groundwork Ohio and use the hashtag #VoteBabyVote. This is all part of our nonpartisan voter education campaign. And so we would love to see those tags and those posts on election day or leading up to election day with early in-person voting. This is an opportunity that's coming up tomorrow at 11:30. We wanted to elevate to you all. The P5 Policy Network, of which Groundwork Ohio is a member, is launching a First Friday webinar series. And the first one is tomorrow, as I said, first thing tomorrow on Friday. And the webinar will focus on building a shared understanding of the systems that support families. And affirming that our united voice is one of our strongest tools for protecting what expectant parents and babies and children ages 0 to 5 rather need. The featured speaker for tomorrow is Dr. Nadine Burke-Harris, former Surgeon General of California from 2019 to 2022. So that'll be a really engaging conversation. There is definitely still time to register. That link should be in the chat to join that call again tomorrow morning at 11:30 Eastern Time.
Thanks, Caitlin.
We
And
also, oh yeah, sorry.
I just want to note on that to encourage people to go, especially if at Groundwork, we are on lots of different federal policy listservs, and in addition to what's happening at the state level and comparing across states. But if you sort of want one high level way to keep the pulse, and that's something that you can take on, I think considering joining tomorrow and at least learning about what they're doing together. This is a cross issue, so it's not just childcare, it's not just maternal and young child health, it's all issues impacting young children, where all the national organizations are doing some really intentional work to try to come together and act in a unified way moving forward. And Groundwork Ohio is grateful to be one of the members of the, I think there's about 20 members across the country, and one of 3 states that's on the coordinating committee. So we'd welcome you and welcome your feedback and trying to get Ohio, making sure Ohio is represented in the national conversation.
Thanks, Lynanne, for those extra details. And I think this is true, and just want to clarify too that this is the first Friday of every month. They'll be held on that regular cadence. Yes. Okay. Great. Did somebody try to jump in? I'm sorry. I thought I heard a noise, but I don't want to talk over anybody. Okay, cool. We also have an advocacy alert that is still active. If you have not weighed in yet, I'll pause here for a moment. You can scan the QR code or click on the link that should be popping up in the chat. This is, again, thinking to what Lynanne shared just a second ago about a multitude of issues, not just healthcare related, not just childcare related, but really a comprehensive ask to our congressional delegation to prioritize a spectrum of needs for Ohio's kids and families, especially as a lot of things are under consideration, a lot of policies and investments that directly impact the programs and services that young kids in Ohio rely on. Pausing here another moment. And Brittany, I'm teeing you up because I've got a couple roadshow slides coming up next.
My
If you're
favorite
ready.
topic. Thank you,
Right.
Caitlin. Yeah, and I'll just while we're transitioning slides, I put in the chat the spreadsheet showing all the legislative races that Jeremy Pelzer runs from Cleveland.com, which I think is the best resource. The House, as they're on 2-year terms, are up every cycle, but they're not all competitive races. A lot of them are unopposed. So you can scroll through your own areas there. The Senate, 17 of 33 candidates are up. And on that note, we are hitting the road this summer. We're super excited. Our goal is to hit all 33 Senate districts, and we would love your help. I've already started having some really great planning calls with folks. Yes, the Safe Babies training is open to folks beyond social workers, and to the question in the chat. And that recording is available. If not on our website, you can contact our team and we can get you the link. So we did this in 2024. I don't want to rehash it too much because we just have a few minutes left, but we're going to go to more places and do a variety of things. So I think the next slide might show our kind of menu of options. For those who participated last time, we did more of a series of community forums, big, broad discussions, covering the vast policy areas impacting children from birth to age 5. We'll still do some of those events, but we also want to do a couple deeper dive discussions. So we're looking for opportunities to do site visits. If you would like us to come out to your child care center, if you have a home visiting programming and you've got a family who would like to tell their story, or something else related from birth to 5, prenatal to 5, we would love to see it in person. We would love to come out, document everything we do. The big benefit at the end of this series is that we'll put together a really robust report of our entire travel series, all of our learnings, all of our quotes, photos, family stories, data, everything we hear from community leaders. All the highlights are going to go into a report that we will give to the entire legislature. We want to be able to say, we were in your community, we were in your area, and this is what we heard from folks on the ground. And then lots of folks from philanthropic areas and all sorts of other decision makers will have access to this report as well. So we think it's a really great resource as we look ahead at the next General Assembly, a new governor coming in, and really try to set the tone and set policies that are great for young children. So we would love to work with you. I see in the chat. Yes, please, please, please shoot me an email. I'll put my email address in the chat. And I am setting up planning calls. We are going to do our best to go everywhere we can. We do have a little bit of physical bandwidth limitations, but we're going to hit every region of the state. Yay, thanks, Tamara. And there are also sponsorship opportunities, so we'll be happy to share those out as well. You don't have to sponsor to participate, but we would love support on mileage and things like that. So Caitlin's got a list here of the things that your sponsorships could help support. I realize we're at 7:59, but I am happy to take questions.
Yes, we'll pause for that.
Aw, thanks, Julie. Yes, a big shout out to Marty Ridley, our digital comms director, for her recognition yesterday as a woman on the rise from the YWCA.
All right, just to close us out, if you're able to join us next week, we'd love to have you. We'll be having our guest speaker will be Lily Gray, who is an endorsed child parent psychotherapy national trainer since 2004. She's also led multiple child parent psychotherapy trainings for the state of Ohio to build up that workforce here across the state in different disparate communities to reach young children that otherwise don't have access to early childhood mental health support. And that is all for today. Thank you so much for your time. Thank you for starting your Thursday with us. I'll stop sharing. If there's any last minute questions, we can hang on for just a second. I know we brought it down to the wire, but otherwise, that is the end of our presentation today. And thanks again for joining us. Thanks, everybody.
Hi, this is Trina. Before we get off the line, is there any way you can direct us to possibly, and I don't know if what you already shared helps, but the ballots in our area?
Yes, yeah, when you say ballots, do you mean what you're going to be voting on?
Absolutely.
Yeah, so that's actually available on the Secretary of State's website. I unfortunately don't have that link handy right now. Let me see though if I can pull it up really quickly.
Yeah, I've
Let's
been on the
see.
website. I just can't locate the current ballot.
Okay, for the primary 2026. Let's see. Oh, I see. It might actually be on your local Board of Elections website. That might actually be the more direct way to get to it.
Okay.
Or let me see. Oh, here we go. Here we go. This is a directory that should give you a sample ballot
Okay.
so that you can click on the county that you're in, and then it should show you what your ballot will look like, and it gives you that opportunity to do some additional research on your candidates.
Thank you, Caitlin. Have a
Of
great day.
course. Yeah, you too. Take care, everybody. Thank you.